Warning signs after you have your baby. This video I talk about the urgent warning signs that might mean something wrong after you have a baby. It's important to know about them things here before and speak up for your own health. If you have any question, ask a doctor, nurse or provider who will look after you during your pregnancy. In this video, we are going to call him your pregnancy doctor. Not afraid to ask someone we can talk to your language if you don't understand what the pregnancy doctor has say. First, we are going to talk about the warning signs them where they might happen after your baby born. Them time call postpartum period. Most of them show up within the first 6 weeks after birth. We not tell you this for frighten you, but we want you to know when you need to go to your doctor. So come, make we go through them now. Headache, where no one go away or I get worse with time. A headache when no stop or keep getting worse as time go by. It can feel like the worst headache you ever have in your life. Even after you take tablet and drink enough water, it still not go away. Sometimes it come on sudden and very painful. It can also make you dizzy and you can't see good. Feeling dizzy or fainting. When you feel dizzy or faint, you might pass out. Sometimes your head feel light or that feeling might stay with you or come and go over a few days. Thoughts of hurting yourself or your baby. You might have thoughts of hurting yourself because you feel very sad, hopeless, or like you let everyone down. You might feel like you have no control over your life. You might be worrying all the time non-stop. You might even have thoughts of hurting your baby or scary thoughts that come to your head when you don't want them to. Something wrong with your eyesight. You might get vision problem like seeing flashes of light, bright spots, or blind spots. You might even lose your sight for a short while. Your vision might be blurry, hard to focus, or you might even see doubles. Fever. Fever is when your body temperature reach 100.4 Fahrenheit or 38 degrees Celsius or higher. Can't breathe good. You might can't catch your breath all of a sudden or it come on little by little. Feeling like you can't get enough air in your lungs. Your throat or chest might feel tight. You might have trouble breathing when you lie down flat or have to prop up your head on a pillow for sleep. Chest pain or heart beating fast. Chest pain can feel like tightness or pressure in the middle of your chest. The pain might travel to your back, neck, or arm. If your heartbeat feel different, like it a beat too fast or it a pound out of your chest, call your pregnancy doctor. Your heart might feel like it a skip beats. You might feel dizzy, like you go faint or get confused. You might find it hard to catch your breath or can't talk and breathe at the same time. Bad belly pain when no one go away. Belly pain that just no go away. The pain can be sharp like something stab you, or it can feel like cramps. It can start sudden or get worse over time. And you might have to deal with bad feelings in your chest, shoulder, or back pain at the same time with your belly pain too. Terrible feeling sick and vomiting. This vomiting and nausea are different from the morning sickness when most women get early in pregnancy. That one is worse. And it become a problem if you can't drink anything for more than 8 hours or can't eat nothing for more than 24 hours. Something definitely wrong. If your mouth dry or you have headache or feel confused or have a fever or you get dizzy, you need to go to a doctor quick. Bleeding or leaking from your vagina during pregnancy. It common to bleed or have discharge after you give birth. It's not normal though when the bleeding heavy and you are soaked through one or more pad in an hour or a pass blood clot way bigger than one egg or if you are pass out tissue. If you have any change in the smell of your discharge, if it smell bad, call your doctor. Your legs swell up, turn red or a pain you. If at any point during your delivery your legs swell up or tender, this might be a warning sign. The pain or swelling typical in a just one leg. It might or might not hurt you when you touch it. It might hurt when you flex your foot for stand up or for walk. The area where your pain might turn red, swell up, or feel warm. This can happen in one of your arm them too. Your hands and face them swell up bad. It's a warning sign when your hands them swell, so till it hard to bend your fingers or put on a ring. When your face swell too, it hard to fully open your eyes them because them puffy. This kind of swelling under the normal swelling that most people get during their pregnancy. That one is much worse. Feeling overwhelmingly tired. When you suddenly feel tired and weak and you don't have enough energy to get through your day. No matter how much you sleep, you still don't feel rested. You feel so tired that you can't get up and take care of your baby. You might also be feeling sad after having your baby. Some of the symptoms you might mean you have specific complication during your postpartum. That might mean after you give birth. Some warning signs like headache, vision changes, dizzy feelings, or like you got faint, bad swelling, trouble breathing, or bad belly pain when not go away could mean you have high blood pressure problem called preeclampsia. If things like these happen to you, feeling more than one pad in 2 hours, passing blood clots as big as one egg, you feel dizzy or faint, it could mean you have a serious type of bleeding called obstetric hemorrhage. If you feel dizzy or faint, have chest pain, or your heart a beat fast, you can't breathe good, or feel extremely tired, that could mean you have a heart condition. Some people have mood changes during their pregnancy. If you feel very sad, feel like there's no hope, no day, a worry or fretting up, feel out of control, or like you don't even know what real or what in your head, that could mean you have a mental health condition. And this happens to some women before they have baby. If during your pregnancy, you use things like tobacco, weed, alcohol, prescription medicine, or drugs, you can hurt your baby. If you have struggled with any of these things, them have enough places out there where can help you during pregnancy, even after you have your baby. The risk of accidentally overdose much higher for people who go back to using them substances in less than a year after having a baby. Any of them things happen to you, call your pregnancy doctor right away if you get help. If you can't reach your pregnancy doctor, go to the hospital emergency room. Tell the staff say you're pregnant recently within the last year. Remember, the things we talk about in another video are very serious medical complications after having a baby. Not ignore them. We don't mean to frighten you or worry you with this video. We just want you to know when something wrong and you need to seek help.